Defining delirium basically is quite simple. It's a condition in which the patient is suffering from extreme illusions, hallucinations, he's disoriented, he's quite irritable, and it's basically an acute mental disorder. What can be the causes to this delirious condition, to this condition which is known as delirium? It can be a fever, it can be any metabolic disturbances that the patient can be suffering from, it can be any trauma, neoplasms, and even infections, as well as simpler forms such as dehydration, which is resulting into delirium, is also seen in a lot of individuals. So all of these conditions, all of these physical conditions can result in a psychological impairment, which is known as delirium. The mental functions are decreased in such individuals. We've already discussed the causative factors, we've already discussed the risk factors, which include the age, the physical health, the mental health of that individual, again is going to contribute towards being prone or to not being prone towards this condition, which is known as delirium tremens or delirium. Now, its diagnosis again is very important. When you have a patient with a confused state of thought form, a confused state of thought content at your hand, you're going to rule out all the physical causes in such an individual that we're talking about. So the diagnosis of the delirium will be discussed over here. We'll be briefly discussing the etiology over here, the causative factors which can result in delirium, and then the examination and the investigations are coupled out together. The examination basically includes the vitals of that person, and then the preliminary investigations would include all the baselines for that particular individual, and just to rule out any metabolic causes, any traumas, any infections in that particular individual that we're talking about. The differential diagnosis again is very important to keep in your mind because you have to rule out to reach towards your definitive diagnosis again. So the etiology would include the head trauma over here, and then the metabolic and the endocrine disorders along with it. Then we also have to keep in mind that it can be substance related. Sometimes it can be an intoxication which results in a state of delirium, and then it can be the withdrawal symptoms of a drug. So if the person was substance misusing and he was withdrawn from that substance in a very short period of time, he may give you symptoms of delirium. So it's again one of the etiology, one of the very common etiologies seen. And then we have the medications induced. So one of the causative factors can be the medications. So even the pharmacology that is usually prescribed over the counter or that is given by the doctor himself or herself can result in a state of delirium in a particular individual. Toxins are released. They can be of a bacterial origin or of the viral origin, which can result in a state of delirium as well. Then there can be patients who are suffering from anemia or iron deficiencies, vitamin deficiencies, and they also can end up in a state of delirium, in a state of confusion as well. Post-surgically, a lot of patients go in this kind of a state, which is quite confusional. The patient is restless, he's having illusions, and infections, obviously it's one of the cause over here. Basically people suffering from fever usually go and they end up in delirious states. Cerebrovascular strokes is one of the leading causes, or they can be one of the causative agents. People suffering from these CVAs or cerebrovascular strokes end up in being delirium. Epilepsy is one of the leading causes as well, and then it can be multifactorial. The same person can be suffering from a trauma as well as an infectious state, and he may end up in a delirious state. So it can be multifactorial in a lot of people as well. So the diagnosis basically consists of the history. First of all, a complete history taking is again very important. As the patient walks in, you're going to take a history which is of the subjective type, and then the collateral history from any friend or any family person who's in close relation with that particular person. Then the previous episodes of delirium are again going to be noted down, and then the relevant factors regarding the causative agent. So we have to keep the causative cognitive agents in our mind that basically revolved around the infections, the traumatizing states that can result in the delirium, and we have to rule them out while we are taking a complete detailed history and documenting it. Again, the diagnosis is very important over here. The examination, if the patient's mental state allows the examination, it is to be carried out in quite a detail along with the general physical examination, including the vitals, and then the systemic examination is going to be carried out in detail as well. Hypoxia as well as cyanosis is going to be noted down while you're carrying out the general physical examination. Dehydration, the state of hydration again was very important causative factor. Constipation or any urinary retention, if it is noted down, then the baseline physical observations are also documented. Cognitive statements, so it's going to be a mental state examination, abbreviated as MSE, for that particular patient that we're talking about. Then the diagnosis again is very important, relating the physical investigations that include the blood tests, the urine tests, the sputum cultures. Basically, what we are dealing over here is we are ruling out any infectious states, any traumatic states. So again, these physical investigations, which are of a preliminary type, are carried out in that individual. Then the radiological investigations to basically rule out any strokes, any hemorrhages in that particular individual. The other diagnostic tools would include the subsyndromal and fluctuating pictures on the EEGs and on the ECGs are again very important over here. And then the EEG, that is the electroencephalogram, is again very important over here. The confusional state assessment method. So to assess the confusional state of that person, what is the severity of confusion that he's suffering from? Is it of a milder form, of the moderate, or of a severe form? We have a devised method which is known as confusion assessment method, and that is devised in such individuals. Basically, it consists of an A category, which is of an acute onset and fluctuating course. Onset is hours to days, and the lucid period often is in the morning. Then we have a B category, which is basically characterized by the inattention, easily distracted, attention wanders in conversations. Then we have a C category, disorganized thinking and cannot maintain a coherent stream of thought. In the D category, we have the altered levels of consciousness. The patient is usually drowsy, overacting, fluctuation, and the nightmares and hallucinations are seen in such individuals. So these are the categories of the confusional assessment method that we are dealing with in such individuals. Then basically we have the dementia, substance misuse, withdrawal states. This is basically the differential diagnosis that we have to keep in mind when we are ruling out and when we are basically carrying out the different investigations in that particular individual. We're going to see if he's suffering from dementia, if he is being intoxicated, is he having any withdrawal symptoms, if he's an addict, and then schizophrenia is also going to be ruled out in such individuals. Depression, it can be one of the leading cause. Conversion disorders, temporal lobe epilepsies, non-convulsive epilepsies are also going to be ruled out in such individuals. So in this section, basically, we summarized how are we going to diagnose the cases of delirium and how are we going to basically investigate the underlying causes in such individuals. So that is the end of this section. Thank you for watching sqadia.com.